Childhood obesity is highly prevalent in Chicago. It's one of the cities in the United States with the highest prevalence of obesity, particularly in low-income communities.
Our school is in a neighborhood on the south side of Chicago. We are in a neighborhood where we lack a lot of the basic fundamentals and structures, such as even a grocery store.
What's important is that this project focuses directly on that population. The goal of the Healthy Smart Schools program is to empower parents by providing them with information on what their kids eat during the school day, as well as knowledge and strategies they can use to help their kids develop a healthy lifestyle.
I learned about the program through a school newsletter. As a parent, I get a letter once a week explaining the nutrition of the school lunches my child receives. This program has helped me implement healthy options such as vegetables, fruit, water, and exercise into my child's diet and lifestyle.
The way the system works is that each student is identified from their student ID, and we have a barcode scanner that essentially scans the ID and creates a record for that student in a database. The cafeteria staff then look at the student's tray and use a touchscreen to enter everything they've chosen, so that information goes into the database as well. And then at the end of the lunch period, our research staff walk around the tables and see what the kids actually consumed and what they've left on their tray. And then that information too goes into a database. And all of that information in that database is processed by us here at Rush, and we integrate that in a report that includes not only everything they've chosen to eat and what they've eaten, but some information and strategies that the parents can then use to make sense of that information and work with their kids on developing a healthy lifestyle.
Two things that kids need is they need to be safe when they come to school. They need to feel safe in a school environment, and they also need to be mentally and physically prepared, and having a program like this allows us to assess where we are and how we can provide interventions for our students.
No prior childhood obesity intervention has provided parents with objective information on what their kids are actually choosing to eat at school. So this is a way to provide that information to parents and engage them in discussions about healthy eating with their kids.
The school has given me a lot of information about nutrition and how to maintain a healthy lifestyle for my family. Prior to the program, my child would eat hamburgers, fries, and soda, but now she wants water, vegetables, and fish.
We would hope that if this project proves that this kind of an approach would be feasible, we could roll this into an obesity prevention program that could be disseminated throughout the entire Chicago public school system.
The Healthy Smart Schools program has benefited from a wonderful collaboration between the Rush Department of Preventive Medicine, the UNO Charter School Network, Canyon Ranch Institute, which has expertise in health literacy, the Chicago Department of Public Health, as well as the funding provided by Hilscher Brands.